Hello, my name is Kelly Kuehl, and I'm a medical student at the University of Wisconsin-Madison. And today I'm going to be talking about our community needs assessment for adults with Down syndrome in Wisconsin. There is a growing population of adults with Down syndrome as the life expectancy for this group has increased, meaning that there is an increased need for adult health care for this population. Transition services can help to transition young adults with disability to adult care. However, the literature shows that many people with Down syndrome are not accessing these services, which can put them at risk for missing out on important aspects of adult health care. We wanted to go into our community to better understand the current needs and barriers to healthcare and healthcare transitions for patients with Down syndrome. To do so, we conducted semi structured interviews with various community stakeholders, including caregivers, adults with Down syndrome, healthcare providers, and community leaders. We also piloted two surveys, one for caregivers and another for healthcare providers. We then analyzed these data for central themes. The most heavily mentioned themes included various comments on the state of healthcare transition, the barriers to healthcare access for this population, and the need for more disability training for healthcare professionals. Some excerpts from the interviews that highlight these themes are displayed at the bottom of the poster. Results from these surveys also supported the central themes from the interviews. One interesting takeaway was that while 17 of the 21 interviewed caregivers felt that transition services would be useful for them and their families, none of them reported these services as easy to find, and 12 had never attempted to access them. Mental and behavioral health services were also among those reported most difficult to access in our community. Some takeaways from the healthcare provider survey included that 15 of the 23 surveyed providers felt uncomfortable adapting healthcare guidelines for adults with Down syndrome, and 16 disagreed that they would know how to transition a young person with Down syndrome to adult care. Overall, we concluded that there is a need for more primary care provider training about healthcare transition so that they can be better equipped to assist with this process and help adults with Down syndrome access appropriate care. In addition, providers of all specialties should be made aware of the new healthcare guidelines for adults with Down syndrome in order to increase their comfort working with this population. Finally, caregivers and self advocates are interested in transition services, but many are not accessing them in our community, suggesting a need for more guidance towards these resources. Some of the next steps that can help address these issues include expanding healthcare transition training activities through our local LEND program, increasing the training opportunities for our primary care providers at UW Health to learn more about the Down syndrome healthcare guidelines. And we ultimately would like to establish a consultation clinic for adults with Down syndrome at the Weissman Center here in Madison. My references and acknowledgments are below. Thank you very much for your attention and time today.